Go ahead, ma'am.
Yeah. Good afternoon, everyone. This is Dr. Poornima mathur from Oasis Fertility, Vadodara. Today, I'm going to tell you something about endometriosis, the enigma that it poses, the challenges that we face because of that, and the sufferings that a person endures because of endometriosis. So, what is endometriosis? We'll be discussing that. What are the different types, the symptoms, and the diagnosis, and how does it affect our fertility? And once we are suffering from fertility issues, like what are the different modalities that are available for treatment, and how does endometriosis impact the outcome of fertility treatment? So endometriosis is a very common gynecological condition where हमारी जो यूट्रस की lining होती है that starts growing outside the scheduled destined place. Now instead of uterus, it will start growing somewhere in the ovary, on the tubes, बाकी body organs के ऊपर और on the peritoneum. So, why are we concerned about endometriosis? Because it roughly affects 10% of women or girls in reproductive age group. When we're talking about 10%, we're talking about 190 million women who are suffering from it. And the irony is that most of them have not been diagnosed or treated for the same. In India alone, there are 25 million women who are estimated to be suffering from endometriosis, with a higher prevalence in the coastal regions. Now, in the incidence in infertile women, women who are suffering from fertility problems, so around 40% of women would be having coexisting endometriosis. And those who already have endometriosis, usme around 50% of women would be experiencing some or the other fertility issues. So, why do we need to know about endometriosis? How is it going to impact us? The most important thing is that it impacts your quality of life. It leads to a low work productivity. It impairs your functional life. It impairs your social life. And it is not a lifestyle disease. So you cannot prevent it. Say, okay, like, how can I prevent myself? So it is not that. If you have endometriosis, you're living with it and it is impacting your quality of life. So how do we know कि हमें कैसे पता चलता है? Okay, fine. We say कि there is such a major bulk that is not being diagnosed or being treated. So the first thing that you would come to know is the symptoms. So if you're young, you have certain symptoms like this. That is where you have to go to your gynecologist for further evaluation. तो जो सबसे पहला symptom that is there, वो होता है dysmenorrhea. Dysmenorrhea मतलब you have painful periods. आपको periods के time पे pain होता है. जब आप अपने पार्टनर के साथ सेक्सुअल रिलेशनशिप में होते हो उस समय आपको पेन होता है अ डीपर डिस्पीरियड मतलब डीप पेनिट्रेशन में आपको पेन होता है एट टाइम्स ऑफ पीरियड्स आपको वॉशरूम जाने में यूरिन पास करने में ये स्टूल्स पास करने में पेन होता है और देयर इज डिसफंक्शनल यूट्राइन ब्लीडिंग मतलब आपकी ब्लीडिंग इरेगुलर है आपको इंटरमेंस्ट्रुअल ब्लीडिंग होती है एंड देयर इज डिफ्यूज एब्डोमिनल पेन होता है या फिर यू हैव डिफिकल्टी इन कंसीविंग. So अगर आप देखोगे the main symptom जो that comes out of all these list is pain. तो endometriosis में there is pain which can be आपको periods के time पे, relationship के time पे, urine pass करने के time पे, stools pass करने के time पे. And that is the main thing that brings एक patient को towards to the doctor to evaluation. So in a nutshell again, these are all the symptoms जो हमारे होते हैं in endometriosis. And why does it happen? So endometriosis क्यों होता है उसके लिए there n number of theories proposed कि हमारे retrograde regurgitation हो जाता है यूट्रस का ब्लड वहां चला जाता है मेटाप्लेजिया हो जाती है बट इन अ नटशेल व्हाट वी हैव टू रिमेंबर इज कि अगर हमारे किसी फर्स्ट डिग्री रिलेटिव को endometriosis है तो chances of us having endometriosis is 7 times higher. Like if in case you have it, so there is a higher chance that even your sister might have it. There is a 7 times higher risk. So once we have the symptoms, we consult a gynecologist. We get a detailed history and evaluation. Now, what are the types of endometriosis? So endometriosis जो है that is हमारी endometrium जो uterine का tissue कहाँ जा सकता है? It can be within the pelvic cavity. It can be outside the pelvic cavity. If it is आपकी सिर्फ ovaries में limited है, where it is usually आप कहेंगे sonography में chocolate cyst बोली है, endometrioma बोला है, that is endometriosis, ovarian endometriosis. Or else deep infiltrating endometriosis है where जहाँ पे endometriosis वाले जो lesions हैं वो आपकी cavity में डीप पेनिट्रेट कर जाते हैं. नाउ दीज आर द वंस जो आपको पेन कॉज करते हैं एंड आर रिस्पॉन्सिबल फॉर ऑल द मेजर सिम्टम्स पर से. Then we have the peritoneal endometriosis. पेरिटोनियम एक लाइनिंग होती है विच कवर्स आपके एब्डोमेन में, आपके पेट के अंदर जो ऑर्गन्स हैं, आपका एब्डोमेन है, स्टमक है, इंटेस्टाइन्स है, ये सारा कुछ, किडनीज, ये सब कुछ जो हमारे यहाँ पे कवर हो रहा है, दैट इज अ पेरिटोनियम. सो नाउ उस पेरिटोनियम पे अगर डिपॉजिट्स होते हैं तो दैट इज द पेरिटोनियल एंडोमेट्रियोसिस. एट टाइम्स ये पेल्विस के बाहर भी जा सकता है, आपके ऑर्गन्स में, जैसे आपके इंटेस्टाइन्स में जा सकता है, विजाइना में जा सकता है, कहीं पिछली सर्जरी में, एंड एट टाइम्स इवन रेयरली आपके थोरैक्स और इन सब में भी. सो एंडोमेट्रियोसिस हैज को काफी डिटेल में स्टडी किया गया. देयर आर बहुत सारे ग्रेडिंग सिस्टम्स हैं वेयर वी गो इनसाइड. हम उसकी डिपॉजिट्स देखते हैं कि कहाँ कहाँ पर डिपॉजिट्स हैं, कितना इन्वॉल्वमेंट है. So, minimal to severe endometriosis, there can be 4 grades of endometriosis. Now, why is it important? Because it helps decide the management of endometriosis. So, how do we diagnose it? तो अगर आपकी signs and symptoms हैं आपकी endometriosis के, तो you will go talk to your gynecologist. आपके डॉक्टर जो हैं, they take a detailed history. हम हिस्ट्री लेके हमें पता चलता है कि ओके अब में क्या साइंस है एंडोमेट्रियोसिस के. एंड देन द मोस्ट प्रेफर्ड मोडालिटी है, सबसे पहले हम एक ट्रांसवेजाइनल अल्ट्रासाउंड करते हैं. नाउ ट्रांसवेजाइनल अल्ट्रासाउंड हमें आइडिया देगा इज दी प्रॉब्लम. नाउ ड्यूरिंग अ जनरल एग्जामिनेशन, जब हम गायनेक एग्जामिनेशन करते हैं, कोई विजाइनल डिपॉजिट्स है, ऊपर स्कार टिश्यू पे डिपॉजिट्स हैं, वो हमें पता चलते हैं. Now, if in case when we do go ahead with an ultrasound, the transvaginal ultrasound, वो हमें बताएगा how are your ovaries, आपकी ovaries में endometrioma है कि नहीं है. अगर deep infiltrating होगा तो हमें आइडिया लगेगा by the adhesions of the tissues, आपकी fixity, mobility. So a transvaginal ultrasound mostly helps us in diagnosing all forms of endometriosis except the peritoneal one, जो उसमें थोड़ा सा difficulty होता है. But the gold standard per se is laparoscopy, because laparoscopy, if you can see the image right now, this is how a normal ovary looks. And if there is ovary में endometrioma, endometriotic cyst है, it would look like this. This is how a normal uterus look, and when it is affected by endometriosis, वो ऐसा look देगा. This is normal peritoneum, and ये है peritoneum जिसमें endometriotic deposits हैं. So the gold standard per se is laparoscopy only. अपार्ट फ्रॉम दैट हम एमआरआई का भी यूज कर सकते हैं, जो हमें एक आइडिया देता है स्पेशली प्री ऑपरेटिवली बिफोर वी गो हेड फॉर लैप्रोस्कोपी सर्जरी कि अडहेशंस कितने हैं, हाउ इज एंडोमेट्रियोसिस में. नाउ व्हाट एंडोमेट्रियोसिस इज बेसिकली, उसमें जब ये एंडोमेट्रियल टिश्यू हमारा और प्लेसेस पे आता है, सिर्फ ओवरी और पेरिटोनियम और बाकी विसरा के ऊपर, it incites an inflammatory response. There is blood, there is inflammation, hence वहाँ पे आते हैं adhesions. जब भी inflammation होता है, there would be healing, and इन सब के attempt में now there would be structures जो वहाँ आके चिपकने की कोशिश करेंगे. Hence हमारे जो structures हैं, जिनकी एक allocated location थी in the body, which is responsible for all the smooth functioning, fertility and everything. Now when there comes adhesions, चीजें जुड़ने लगती हैं, hence come the symptoms. Now अगर हमारे adhesions होंगे, nerve endings affect होती हैं, we will have pain. Bowel पे adhesions होंगे तो हमें stools pass करने में problem होगी and pain होगा. Blood involvement होगा तो हमें urinary complaints आनी शुरू होंगी. जहाँ हमारे pelvic structures like हमारे uterus and tubes ये सब adhered होंगे तो it will affect the fertility potential. If the ovary is impaired, तो हमारी ओवरी अगर इफेक्ट हो रही है तो हमारा ओवेरियन फंक्शन, फॉलिकल बनना, ये सब हमारा इम्पैक्ट हो सकता है. तो ये एडेशंस कितने हैं, क्या है, दैट कैन बी लाइक assessed with the help of MRI. So the gold standard being laparoscopy. तो हमारा ट्रीटमेंट क्या है? Now once if we've diagnosed it, how do we proceed with treatment? Now it depends on the symptoms. Now हमने जब symptoms देखे थे, हमने कहा था the main symptom that came out of the entire list was pain that is associated with it. So when a patient comes to you, हमारे पास आप आते हो किसी कंप्लेंट से, तो it is, अगर आपका prime symptom pain है, तो we have to treat the pain plus associated whether you want a fertility या आपको periods manage करने हैं, or you want just the quality of life, you're not bothered about fertility. So it would depend upon what stage of life you are in at that point of time. So pain can be managed with the help of painkillers. Now, endometriosis is quite notorious for the amount of pain that the patient faces because of it. So at times आपने देखा होगा, it the severity can absolutely vary between 2 or 3 patients who have endometriosis. एक जिनको सिर्फ ovarian endometriosis है might not have any pain despite of having a huge endometriotic cyst, बड़ा endometriotic cyst होने के बाद भी उनको सिर्फ हो सकता है सिर्फ pressure symptoms and diffuse pain हो. वहीं डीप इन्फिल्ट्रेटिंग एंडोमेट्रियोसिस अगर किसी को है, उनका पेन कैन बी quite out of proportion, not relieved by simple painkillers. So the pain की frequency varies, the treatment also varies. We start with simple आप painkillers से आपको अगर आराम नहीं आता, it is combined with hormonal treatment, जो बहुत सारे different forms में हो सकता है. Simple oral contraceptive pills or progesterone tablets or एगोनिस और LNGIUS, ये सारे जो what suits best for you would be decided by the doctor कि आप किस उसमें आ रहे हो, which is going to give you the best benefit out of all the treatment modalities available. Now comes the main thing where there is an enigma is the surgery in endometriosis. Now, laparoscopy being the gold standard for diagnosis, is every patient with endometriosis subjected to laparoscopy? If yes, how, and if no, why? So not every patient is diagnosed on the basis of a laparoscopy because वो एक invasive approach है. Now we clinicians believe that there should be a proper indication for laparoscopy. Now when do we go ahead? Now I would be talking a little more specific about people who are struggling with fertility issues. So now if I have a couple जिसमें हमारी अगर फीमेल को अगर हमारे एंडोमेट्रियोसिस का प्रॉब्लम है प्लस वी आर हैविंग इनफर्टिलिटी का, so now when do we go for laparoscopy? The laparoscopy is indicated if the patient has severe pain which is not relieved by hमारी oral medications, because at the end of the day the quality of life takes a precedence over so many things. So अगर आपका pain है out of proportion which is not being managed by oral medications, that would be an indication for laparoscopy. If in case we are planning to take you up for a fertility treatments, for instance assisted reproductive techniques हम use करने वाले हैं or IVF in a simple language अगर हम IVF use करने वाले हैं, so before the IVF treatment or after the IVF treatment, that there comes a question कि endometriosis अगर हमें है, so do we go ahead with the surgery before or after the treatment? So अगर आपको IVF में आइडिया होगा, IVF में we usually give you injections कि आपकी ओवरी में eggs बने and those eggs are taken out and वहाँ बाहर आपके embryo बना के and then they are placed back. So when we are doing this egg retrieval stimulation ASAP, so laparoscopy is done before the stimulation or before the IVF only अगर हमें आपकी ओवरी जो है इट इज डेंसली चिपकी हुई है और अडहेड समवेयर जिससे मैं हम उसको वजाइनली एक्सेस नहीं कर सकते. Where the ovaries are inaccessible, that is where we go ahead with a laparoscopy initially, or there is even in cases of big endometrioma. Now there is a controversy whether a more than 4 centimeter endometrioma should be removed first or after the stimulation. So there have been recent studies in international journals जो कहते हैं कि if in case the ovary is accessible, आप उनके follicles निकाल सकते हो, तो preferably we should go ahead with your stimulation, आपके egg निकालें and then go ahead with the laparoscopy before the embryo transfer. Or if there is intolerable pain which is not being managed medically. Now why so? Because we know the laparoscopy or any surgery अगर हम ovary में करें या ovary contains all the eggs आपके जो है to give you pregnancy in the future. Now this when we are removing the diseased part or the endometriosis, there can be an effect on the normal healthy ovary as well. So when we go ahead with laparoscopy, we usually prefer using minimal energy sources. मतलब हम heat कम use करते हैं. We use cold scissors and no energy sources to remove the endometriosis. The endometriosis we make sure we remove the entire cyst wall. Now, when we are going ahead with laparoscopy, what all do you expect out of it? Now, when we are going ahead, laparoscopy में we would expect कि अगर कोई भी हमारा endometrioma हमें दिख रहा है, endometriotic lesions दिख रहे हैं, the ovaries are free. जो internal pelvic anatomy हमारी होती है, that anatomy is restored. Now, anatomy restoration का मतलब है, now इस एंडोमेट्रियोसिस में जहाँ एडेशंस होते हैं तो आपकी ट्यूब्स, आपकी ओवरीज, आपका बॉवेल्स दैट इज इंटेस्टाइन सब आपस में चिपकने की कोशिश करते हैं, एंड दैट टू आपकी पोस्ट पाउच ऑफ डगलस में पीछे की तरफ यूट्रस के पीछे. नाउ हेंस आपको पेन भी होता है, डीप डिस्पेरियूनिया दैट इज रिलेशनशिप को रखने में भी पेन होता है, and we have difficulty in accessing your ovaries and you have difficulty in conceiving as well. So when we go ahead for a laparoscopy, we make an attempt कि हम जितने आपके endometriotic lesions on the peritoneum or the extraperitoneal surfaces or in the ovary सब हैं, हम सबको एक्सरसाइज करके आपकी anatomy restore कर सकते हैं. Now what are the benefits after a surgery? Now once is that आपका pain is significantly reduced. नेक्स्ट इज इफ देयर इज अगर अडहेशंस थे जिसकी वजह से आपकी ओवरीज एक्सेसिबल नहीं थी, सो दैट ओवरीज कैन आर मेड एक्सेसिबल फॉर फर्दर आईवीएफ प्रोसीजर्स. If there is any hydrosalpinx, अगर tubo-ovarian mass बन गया because of the endometriosis, a clipping can be done so that ये inflammatory fluid does not come into the endometrial cavity and affect further fertility potential. Now, the extent of the surgery now would depend upon the हमारा कितना adhesions है अंदर, how much involvement is there of other organs as well. So as I was saying, when we remove any endometriotic lesion from the ovary, जब हम remove करें, so there is a chance that the healthy ovary tissue जो है ovarian tissue उस पे भी effect हो सकता है, they cohabitate. So hence जो AMH हमारा होता है, which is a marker for ovarian reserve, that tells us about what is the egg reserve in a particular ovary. So if we compare AMH of a particular person, हमारा surgery से पहले and surgery के बाद, तो we expect a decline in AMH. So the AMH would decrease because of because of the loss of ovarian tissue. हम endometrium भी remove कर रहे हैं. So the AMH is bound to decrease after a laparoscopy, but it is so. If I have to summarize it, laparoscopy is the treatment of choice. It is done आज के days में only when the pain is not responding to any oral medications, any hormonal therapy, or before an IVF procedure when the हमें ovaries को accessible करना है. Once we've taken out the eggs, if the ovaries are accessible, we can go ahead with the surgery and down regulation after the egg retrieval, before the transfer. So laparoscopy is before ART. It is not routinely done in grade 1 and grade 2, done for pain relief, improving access to the follicles. हमने already discussed किया. Now, how does endometriosis affect our fertility? So हमने briefly हमने discuss किया ही है. So the anatomy of the pelvis is distorted. Now the tubes which are supposed to catch the follicle from the ovary and then transfer it all the way, embryo बना के transfer it all the way to the uterine cavity. Now this tubo-ovarian relationship gets distorted. There are adhesions which prevent the movement or they may even lead to tubal blockage. Now fallopian tube के ऊपर है, scarring होती है, tubes block हो जाती है. हमारे endometriosis के साथ there is significant inflammation associated. Now this inflammatory fluid and inflammatory जो hormone markers होते हैं, they can affect the receptivity of the tissues, their response. They can affect the hormonal environment of the eggs, the endometrial quality for implantation, and the egg quality can be altered. There are too many factors which affect the fertility. So what is the usually preferred line of treatment? So अगर endometriosis grade 1 grade 2 है, that is minimal to mild endometriosis है, that is where we say कि okay, instead of simple जो first line treatment होता है कि ovulation induction with a natural relationship valley planning, we have to move ahead from it and go ahead for with IUI cycles. Now, if it is anything beyond grade 2, like grade 3 or grade 4, so in that case, we have to go ahead with IVF only to improve the chances of conception. So, treatment options for endometriosis, अगर हमें देखना है surgery, तो surgery is mainly for reducing pain. The risk associated with surgery is damage to the ovarian reserve. Now, IVF जो है, that is preferred for fertility basically. It would not have any impact on your pain or your endometriosis per se. It just improves your chances of conception. Now, oral medications would help in reducing pain and the cost is low, invasiveness is less. But the hormone suppressions and all, they have their limit because of these effects associated with it. जैसे हमारी calcium suppression होता है, bone health affect हो जाती है हमारी. So if you have any symptoms that are associated with endometriosis, you need to consult your gynaec, where we evaluate you further based on an ultrasound. If we have an associated infertility issue, depending upon the various factors, like what is our existing हमारा ovarian reserve क्या है, the age, the duration of infertility, a decision for fertility treatment is taken. Whether or not and when to undergo a surgery would be a very personalized approach that would be decided depending upon what is the primary symptom that we are associated with, what is the status of your accessibility to ovaries in case we are going for ART techniques, and the reserves that we have already. So these would be the different treatment options. I know living with endometriosis can be very, very difficult considering the huge impact on quality of life, both physically and emotionally. But there are many treatment options available. The journey is definitely difficult. I would not say people who are suffering from endometriosis, you can have a cakewalk journey. It is very difficult, but you guys are born fighters. You are, so keep fighting. And we at Oasis would be there to help you out with at any step of your journey to make it a little smoother, little easier for you during this entire course. Thank you so much. Any questions? The complications of endometriosis, the endometriosis per se is associated with n number of complications. Now, if the endometriosis first is the, it would be basically the symptoms. If you're talking about the surgery, they are different. So we have fertility issues, we have pain, severe dysmenorrhea, which is not relieved by medications, and it severely impacts the quality of life. And if we talk about complications of surgery in endometriosis, it would be decrease in ovarian reserves that we have, injury to other organs, especially the bowel, the sigmoid colon, which is most commonly adhered, injury to the ureters or the bladder. What is endometriosis? I think we've discussed this in detail in our presentation. The diagnosis is based on signs and symptoms and supported with a transvaginal ultrasound, and the gold standard for diagnosis would be a laparoscopy. Yes, can endometriosis cause infertility? Yes, 50% of women suffering from endometriosis suffer from infertility as well. Yes, it has a major contribution towards fertility issues. Stigmata of endometriosis. Trust me, living with endometriosis is not at all easy. It's very difficult. It is basically the pain and the which severely affects the quality and standard of life is for endometriosis. Further, the effect on fertility adds to the emotional trauma of endometriosis. Thank you so much, and feel free if you have any queries to contact us. We would be happy to help you with any assistance regarding any queries related to infertility or any other fertility issues or endometriosis. Thank you so much.